Welcome everyone to the third edition of Empowering Seniors Now. My name is Elizabeth Manso, and I would like to welcome our guests to the third edition of the Empowering Seniors Now webinar, and we are excited to share some great information with you today. We will have 3 10 to 15 minute sessions for you, and we please ask that if you have any questions that you post them in the chat, and they will either be answered at the end of each session or possibly answered during the session. At the end of the last presentation, we will give away a prize to one of our guests, so please stay with us to the end if you are able to be eligible to win the prize. At this time, I will turn it over to Brittany, who will introduce our first speaker.
My name is Brittany Reckert, and I'm happy to introduce to you today our first speaker, Doreen Seaman. Doreen Seaman is the owner of Seaman Law Offices, PLLC, which serves both West Virginia and Pennsylvania. In her time as a practicing attorney, she has guided hundreds of families through critical estate planning decisions at varying stages of life. She is highly experienced in obtaining long-term care Medicaid benefits and veteran benefits for those in need, as well as settling estates. Doreen partners with accountants, financial advisors, insurance agents, and bankers to maximize results in each of her clients' unique situations. Doreen and her team strive to help their clients achieve their goals regardless of their means. Doreen strongly believes that knowledge is power and is devoted to sharing her knowledge of estate planning and elder law in her community. She is the founder of Kadai's LLC and Its Answers television series, including Elder Care Answers. Doreen is also featured monthly on WAJR's Ask the Expert series, and she authors a monthly article in the Dominion's Post Senior Post magazine. In her spare time, Doreen serves on the board of the nonprofit PACE Enterprises, whose mission is to help people with disabilities find meaningful employment. She is the proud mother of 3 adult children and 2 granddaughters. Doreen was born and raised in Pennsylvania, raised her family in West Virginia, and recently relocated to southwestern Pennsylvania to be closer to her son and his family. Without further ado, I'd like to introduce Doreen Seaman.
Good afternoon, everybody. Thank you for coming back to Empowering Seniors Now this month. This month, we're going to talk a little bit about what happens if you don't have a will. If you watched last month's episode, we had what a will does. So now we're going to talk about what happens if you actually would die and you either don't have a will or your will failed for some reason or didn't cover something. So as always, I encourage our listeners and viewers to make sure that they always choose to be in control. And so our tendency is, if we are nervous about something, is we procrastinate. We don't want to do something because maybe we're uneasy about the decisions or the possibility of conflict over those decisions. And after working with literally thousands of people over the past more than a decade to work on estate plans, to resolve issues from estate plans, the best way to have peace of mind and to have control is to sit down with an estate planning attorney you trust and hash out some of those decisions, because often the things that are holding you back have an easy solution if you just talk to the right professional to get some guidance. So these are some of the basic documents that should be in every person's estate plan. Now, time passes really quickly. So if you think that you have all these documents in place, get them out, dust them off, and look at the date, because almost always they're much older than you think they are. And the powers of attorney and living wills, and sometimes even the will, should be updated from time to time to keep up to date with changes in the law, changes in your family, and with the powers of attorney and living will, just to keep them fresh so that if they need to be relied on sometime, that the professionals they're working with, the bank, the doctors, they know that they can trust those documents. So you need that estate planning foundation, a will and powers of attorney for medical and financial decisions to, as I said, retain your control during your lifetime, and then to make things easier for your loved ones, because those are going to be the tools somebody uses to help you either during your life or after your death. So today we're focusing on the will, but really more the lack of a will or one that does something. So as always with estate planning, there's a lot of misinformation and confusion out there. And the one thing that you need as a takeaway from here is that not all documents are created equally. So if you get a simple will from a general practice attorney, and it's not covering the potential for you or a loved one having an incapacity, or maybe even an unexpected death where an heir dies before you, then your document's probably not covering what you need it to. And you need to talk to somebody who focuses not just as a lawyer, but also into estate planning and maybe even elder law. So your will appoint somebody called a personal representative, and a lot of people refer to that as an executor, to be in charge of your estate. Now, they have to follow the rules. They follow the rules in your will. They have to make sure that they comply with West Virginia. And between the West Virginia default laws and what your will says, that will control what your executor does to make sure your heirs receive their inheritance, that your creditors are paid. And that process is called probate. And probate is a very structured process. In West Virginia, it takes at least 5 to 7 months. And your will, as well as what goes through it, are all public record once you pass away. And a lot of people are surprised to hear that. So that's what a will does. But what if you don't have a will? Or what if your will doesn't answer all the questions that your executor and the court need answered to follow that? Well, then we're going to go to the default laws. So one of the biggest things are the laws of intestate succession. And that is a big mouthful, but really what that's saying is who gets your stuff? If you don't have a will, then how do we know who gets your stuff? Well, West Virginia has laws for that. And because it goes to those default laws, if you want something else to happen, then your goals might not be accomplished. It might lead to litigation, and then it's much more likely that it's going to tear your family apart because people probably aren't going to be happy with it. So first of all, the court's going to have to determine who your personal representative or executor will be because you didn't name one. And in law school, they always call that the race to the courthouse. Who in your family or has some interest in your estate is going to get to the courthouse first and try to be appointed as the personal representative. If you don't have a will that says your personal representative won't have to pay a bond, then the default law says they will have to be bonded, and they don't get that money back. You're giving up the right to make decisions. All of the decisions will be determined by state law, who your heirs are, who your personal representative is, when your heirs will get their inheritance. The estate still goes through probate. It's just the rules are a little bit different if you didn't have a will. Your estate is still public record. And if you have minor children, you won't have the opportunity to name a guardian for your children because we do that in our will. So let's start first with the personal representative. Who is it going to be? Well, we have the race to the courthouse. So the law says that the preference is first given to your spouse, but if they're unable or unwilling, then it's going to be who would be entitled to the inheritance pursuant to state law and who the court sees fit. So let's say, for example, I have 3 children. So if my husband couldn't or wouldn't serve as my personal representative, then my 3 kids could race to the courthouse to see who would be appointed. Now, what if I have 3 great kids, but what if 1 or 2 of them weren't so good with paperwork, with money, they weren't very reliable, but that's who the court picked because I didn't want to make that decision. I didn't want to hurt anybody's feelings. They might appoint the wrong person. So I should just appoint the person who I think would be best, or it would be easiest to come to West Virginia and do that because all of my children live out of state. So if there's not an applicant for personal representative within 30 days, the court might appoint somebody. So maybe it's going to be the creditor. Maybe I was in the hospital with my last illness and I owe WVU hospitals money. Then they might appoint them because they have an interest in my estate, or maybe some other person. After a couple months, they might just give it to the sheriff to take care of. So I'm giving up a lot of control there. Now, most people would say in their will that their personal representative doesn't have to pay a bond. But if your will doesn't properly state that, or you don't have a will, they will pay a bond, which is usually somewhere around 5% of your gross estate. So even though maybe only my checking account is going to go through my estate and my retirement account is much bigger than that, much larger, my IRA, the 5% is even part of that, even though my IRA named a beneficiary, so it's not going through my estate. So it could really add up. And that bond fee is not refundable. And it just feels like a lot bigger hurdle. And if you think about it, if you are related to the person that you're serving as the personal representative for, it's kind of offensive that you'd have to pay a bond. I've seen where spouses had to pay a bond because the will was worded weirdly, and it didn't really clearly say they didn't have to be bonded. So it's very important. Next, we have to think about, well, who's going to be your heir? Now, this gets a little bit complicated, but I'll try to keep it simple. Generally, if all of your children and your spouse's children are from your relationship, then the court's going to figure that law predetermines that your spouse should be the beneficiary, because if your kids should get anything, they love them the same as you, and they'll take care of the kids. So if all the children are of that relationship, everything goes to the spouse in West Virginia. Now, if you don't have a spouse, it goes to your children. And your children include all adopted and biological children, and that's regardless of the relationship. I cannot tell you how many times I've sat with a client and they didn't list certain children on the information they gave to us to prepare for the meeting because they have a bad relationship and maybe they haven't talked to that child for months or years. If they are your adopted or biological child, it doesn't matter if you hate each other, if you are estranged, they are your kid and they will inherit. And then if you don't have a spouse or children, it goes to your parents. If you don't have parents that have survived you, it goes to the descendants of your parents. So that would be, usually you would think of as your siblings or perhaps step siblings, then your grandparents, then your grandparents' descendants, and then the state of West Virginia would happily take your money. Now, if you have a blended family, this is where it gets a little confusing. So if you and all of your surviving descendants are also the descendants of your surviving spouse, then your surviving spouse gets 3/5. But if he had children that weren't outside of that, then he would only, if you had children outside of your relationship with your spouse, then he would only get half. So what they're thinking is, he's going to get less because some of your kids weren't his kids and he might not take care of them. So that's how they determine it. So it's going to be 3/5 or 1/2, depending on if all the kids are of that relationship or not. So if you don't have a will, then it's also the state laws are going to also determine how and when your beneficiaries get their inheritance. So if you're an adult, you're pretty much going to get it outright. If you're a minor under the age of 18, then the court's going to have a say in how that money's spent and who manages that money until the child turns 18. Now, once the child turns 18, legally they're an adult and the court will give them that money. And there's not a whole lot we can do about that. And interestingly, most of my clients, years ago, they used to say they were ready for the child to have their inheritance when they were 21. Nowadays, people kind of think of 25, figuring the kids will get out of college, learn how to manage a budget, and then have the rest of the money at 25. But they do have it set up that they can use the money for college and all that sort of thing. So 18 years old is pretty young these days. Now, the best way to maintain control is to work with an estate planning attorney now while you have the capacity to do so. I wouldn't rely on an online program like LegalZoom. There are things that could be missed in that. There are lots of questions that we ask our clients, and follow-up questions to those questions. And I've seen plenty of fill in the blank wills or electronically created wills that are missing things. So I would talk to your estate planning attorney to make sure that your wishes are going to be fulfilled. And if you can't decide on something, that doesn't mean to procrastinate. It means you should talk to them even sooner. Next month, we're going to move on beyond the last will and testament, and we are going to start talking about revocable living trusts, which we call in our office your bucket. So thanks everybody for listening. And if you have any questions, just put them in the chat and we'll go over those here shortly.
I don't think there's any questions. So Liz, if you want to go ahead.
Sure. Thanks, Doreen. We will now move on to our next speaker, Booker Walton III. Booker is the owner of Mountaineer Technology Consultants, LLC. Having been a computer enthusiast since the age of 6, he's worked in the technology field for over 20 years. While the business has grown, Booker has made sure that MTC is very community-centric, working with a variety of nonprofit partners and community resources. If you were to ask him, though, he began the seeds of Mountaineer Tech working with senior citizens, giving them technical help and advice. He has built a strong network of senior citizens that he makes sure that no matter how busy he is, they get the important technical help that they need at an affordable price. His goal is to arm people with data to make informed decisions with their computers and technical information. Booker spends his spare time with his 2 children, Claire, age 12, and Tristan, who is 5. He resides in Morgantown and has been a lifelong Morgantown resident, committed to the improvement of the greater Morgantown community. His partnerships with nonprofits, as well as being on the board of directors of Girls on the Run, demonstrates his belief in community growth. I'm happy to introduce you to Booker Walton.
Thanks, Liz. I appreciate that. Good afternoon, everybody. Let me just step back real quick. There we go. So I wanted to talk about something fun today. This was actually inspired by one of our other panelists, Doreen. Wearable devices. I wear a smartwatch, but there are so many other things that you can do with wearable devices now today. Technology is an amazing thing. And I wanted to talk about some of the devices out there that are more than just what's on your arm. We'll talk about that, but some of the other things too that can help you improve your life and in some cases, improve the quality of life or even save your life. So let's get into it a little bit. The world of wearable technology applications. This might be a little hard to see, but if you look through the sectors there, it has business operations, it has security and safety, medical, wellness, sports and fitness, lifestyle and computing, that's definitely me, communication and glamour. Technology has gotten smaller and smaller nowadays. It's amazing when you think of the fact that, you know, the first computers that came out were so huge they could barely fit into a data center. And now the watch that I have on my arm right now is more powerful than even those first computers. And yet it's literally 1/100,000th of the size. It's incredible how they've taken technology and put it into something that can be in your hand, whether it be something you wear, your phone, a tablet. It's just incredible where it has gone. Let's talk about what we're going to get into today. Wearables for seniors. And like I said, the first thing there is the possibility of saving your life through medical alerts and vital sign monitoring. The amount of technology in these little devices is incredible. Most of what you see in the next one, fitness and health tracking, is what we think about as well. The steps and calories, tracking all that, your blood oxygen levels. It can do all of that right off of your arm. But the third one is really good too. When you talk about mental health, depression and anxiety, it monitors those things through different devices. And even if it's something as simple as telling you to get up and stretch or whatever, just that move, just that little bit of movement can make your whole day, or just telling you to do something else. So there's different type of wearables out there, and we're going to talk about each one of these. Multifunction devices are the ones that we would typically think about. For instance, I have a Samsung Gear watch on my arm, or of course the Apple Watch, and we'll definitely talk about those. The other ones we would think about mostly would be fitness trackers as well, and we'll get into that. But there's also these other ones, and I thought I'd be interested to talk about some of these devices, heart-related devices, for people predisposed to heart conditions, arthritis and chronic pain. There's things for that as well. diabetes, cognitive conditions. Who would have thought when you think about Alzheimer's and dementia, there are devices specifically for that. And then of course, vision. I think you're going to see something really neat at the end of this presentation: vision, hearing, and sleep. So let's dig a little further. So the multi-function devices, of course, we're talking about, you can see here, I have one that says SOS, that's a Samsung watch. The other one on the right of it is an Apple Watch where you could have taken a fall. But there are specific ones that are medical alert service, and Mobile Help and Freedom Guardian both create devices that literally will tie in either to your doctor or to their subscription services. You have to pay a subscription fee. And through those, you have constant monitoring right on your wrist of your vital signs. If something changes, if you take a fall, it calls directly out, and it also sends information directly to your doctor, your PCP, whoever needs to have that information. These services will put it through their constant monitoring. Now, you have to pay a service fee for that, but for some people, this is absolutely vital, and these do exist. Now, the ones without the medical alert service, I've named a couple of them here, the Apple Watch and the Samsung Gear. They do have that information. For example, you can see there on the right with the Apple Watch, if you take a fall, you can have it set up to where if you take a fall, it will ask you, do you want an emergency SOS or are you okay? If it sees a sudden movement of some sort, it will come up. If you do not answer, it will automatically do the emergency SOS and call out to the contact. Same thing on the Samsung Gear watch. I had to look this one up, but it is there. You do have the ability where it will send an SOS to your emergency contact. So those are typical multi-function devices, one that work with actual service, ones that work without, but will get you help in the time that you need it. Now, the more general things are the fitness trackers that track the different activities. You can read them there: sleep and heart rate, what kind of activity, calorie step, and those are more health oriented, right? Those are more so you can maintain a healthy lifestyle, track your progress, calories burned, things of those natures. Garmin and Fitbit are the two major ones. There are plenty of others as well. I put a picture of a Garmin there on the left and a Fitbit on the right. You see many people wearing these. A lot of people like the sleekness of the design. They don't want the full watch on their wrist. They want something that is sleek, easy, don't really feel it on their arm. These fit the bill for that particular sort of thing. Now, this is where I thought this was interesting. Heart-related devices, ECG and EKG monitoring, connecting directly to your smartphone. That is what I'm talking about with technology. The smaller the technology, it seems, the more it does nowadays. And these are for people with predisposed risks to heart issues. And the top one there is the Cardia Mobile. I want to talk about that for a second because Cardia actually has a watch. It's a band. Well, I'll change that around. It's a band that actually fit on the Apple Watch Series 1, 2, or 3, but for some reason it wasn't improved in the United States. So they had to, you change the band on your watch and it would monitor these things. So they had to change their base a little bit. And the one that you see on the top is a wireless EKG monitor that you can actually put on and it will check you. And of course, if you can pay for their service, and it will send that information to your doctor, to your PCP, whoever needs it. I thought that was pretty awesome. Now, the other one, the one below it there, the Omron Generation 0, you can see that's a watch. That's a watch. But again, it is going to monitor. They have a mission called, and it's Generation 0, but their mission is to have 0 heart attacks and 0 strokes. It's focused on your blood pressure, and it wants people to change from checking their blood pressure to monitoring it constantly. I thought both of those were pretty neat. And that's just the example of the kinds of tech that are out there. Let me continue. So with arthritis, I am a big believer in the TENS unit. Not that I have arthritis necessarily, but pain management, let's just be honest. As we get older, we have creaks and pains that we didn't have when we were a little bit younger. I am certainly in that category. You have a couple different types of TENS units, which are electrostimulated relief. I'm sure many of us are familiar with this from going to physical therapy, but there are home units you can buy. The one on the right is a very small one that you can actually put on right at the pain point. You can see you have the 2 pads and you have the middle device, and that allows you to put basically stem relief directly on the spot. The one that's underneath it is one more like what I have, where you actually have different pads that you can plug into it. You can turn up the intensity, you can change the frequency, the pulse level of how the electrostim comes through. That's one I have. It's a little more complicated, but the price on these have come down so much. They're quite affordable to have in the home. And it's not just good for us as older people, kids, as they have little aches and pains and injuries and things of that nature. Certainly you want to learn how to use them, but I am a big believer in 10 unit, and this helps with chronic pain tremendously. Right here, obviously diabetes. This is very common that you have your home testing kits. And the thing about it is, again, with your smartphone, with these devices, all this information is easily accessible, easily stored, easily given to your PCP or whatever doctor that might need to have it. This is just another example of the different things that you can have that are not just they're not dumb technologies. They are smart technologies that you're able to have that information at your fingertips at all times. Now, this I thought was ridiculous. Cognitive conditions. And of course, we're talking about dementia and Alzheimer's disease. But let's talk about that picture on the right, GPS tracking. Unfortunately, we've all heard of this. Sometimes we'll be watching the news and we'll talk about a missing person and that nobody has seen them since certain time. A GPS shoe insert that works with your smartphone that quite literally will keep you monitored as to where you're at. That is just unbelievable technology. No, I did not know this existed. This was something I looked up in the course of my research for this presentation. I just thought that was really neat. And for the people that we care about, that we can't be there 24/7, this could save a life. I mean, there is no question. Another thing that helps with dementia and Alzheimer's is smart home speakers. Just that ability to have that communication back and forth, they say really helps. And a new one that seems to be coming out is virtual reality. I'm sure we've heard of the Oculus and the Oculus 2 and things of those natures. There's some research being done that says those virtual reality machines are helping people with these conditions be able to live as much of a normal life as possible. But I just thought that GPS tracker shoe insert was amazing, and I wanted to make sure that I put that in here. So here again is something that I think is really neat when we talk about vision, hearing, and sleep. If we talk about that picture on the left, that is a Braille and tactile smartwatch. That's unbelievable to me. So if you look at it closely there, you can see it has two buttons at the top, and then it has the Braille right there. If somebody calls your phone, it will change the Braille to let you know who is calling. If you want to ignore the call, you hit the bottom button. Say your boss is calling you on a Saturday. You hit the bottom button, it will ignore the call. If you want to answer, you hit the top button. It will also help you read text messages. It is one of the more neat things that I ran across in doing my research for this. Hearing aids, obviously hearing aids need adjusted. There's hearing aids that can attach to your smartphone again. Put them in, you're able to adjust your hearing up and down based on what you need, based on the sound level and the noise level that's around you. Just amazing what technology does today. And then the last one, the picture on the right, is for sleep tracking. If you want to track the quality of your sleep, if you're a snorer or what have you, trying to fix that, all of that stuff is wearable technology that you can wear at night that puts all of that information into your smartphone. And all of a sudden, you have that data ready to present when you go to your doctor. Just an amazing amount of technology. I thank for Doreen for giving me the idea to talk about. There's so many useful things out there. And a lot of it is there's so much we just get overwhelmed with the amount of things that we can have. And hopefully today this helped you to pare that down a little bit, and maybe you see something that's interesting to you. And if you do, and if you want more information about it, please reach out to us. We'd be happy to help. With that, if we have any questions, that's fine. If not, I'm going to get ready to introduce our featured speaker for today, Cindy Woodyard. And I think we are okay. So I am honored to introduce Cindy. Cindy is a friend and a professional colleague. She is the Vice President of Public Affairs and Access for West Virginia Caring, also known as the Hospice Care Corporation. As a native of Grafton, West Virginia, she graduated from Bethany College and served as a graduate assistant at the WVU School of Journalism. Cindy spent most of her marketing career in the emerging wireless telecommunications industry at the major wireless companies. During this time, she demonstrated a results-driven track record combining advertising, public relations, and marketing in new markets. This experience prepped her for the work ahead in the hospice industry with competitive regional markets, regulatory changes, and advocacy. Cynthia spent the last 12 years in her current role for the nonprofit Hospice Leader. She is passionate about ensuring that all West Virginians especially those living in rural areas, receive the highest quality end-of-life care they deserve. She serves as development chair for the Hospice Council of West Virginia. So without further ado, Cindy, I am honored to introduce you. I'm looking forward to your presentation. You can go ahead and share your screen, and we are excited to hear from you.
Booker, could you help me out with my share?
Absolutely, I will help you out for share. Just give me one moment.
What a wonderful introduction, Booker. Thank you for having me on your show. It's quite an honor to be able to talk about end of life at this point. So many of us are baby boomers. If you didn't know, there are 10,000 people turning 65 every day. And that will continue till 2030. So there's a lot of people that are entering the last few decades of their life. And there's going to be a lot of choices to make. And you need to know that you have the choice for yourself for any decision you want to make. They're not made by your doctors, they're made by you. So let's talk about choices. It's interesting. Can you believe we consciously make about 35,000 decisions each day? Some are probably unconscious and some might be important. The average person will make almost 750,000 decisions over their lifetime, and they will come to regret about 150,000 of them. Hopefully it's not with end-of-life care and having any coulda, woulda, shouldas. You don't want that for sure. Think about some of the choices you have to make. And at end of life, there are a lot of ways you can go. Things that you might be thinking about. Have I done advanced care planning? What about my family? I don't want to be a burden. I'd like to be able to say goodbyes. I don't want to be tied up to machines. I don't want to die in a hospital. These are all choices that you have to empower yourself to make sure that your wishes are known. Now, this is called the continuum of care. In medicine, it describes the delivery of health care over a period of time in patients with a disease that covers all phases from diagnosis to the end of life. On the left side, normally that's a person that's healthy, or they're finding out that they're beginning to have a disease that they were unaware of, and you'll see the curve, how it progresses. And in phase 2, it'll become a little more chronic. There'll be other things that you'll need to worry about. If it's lungs, it's having trouble breathing. If it's other things, there might be significant pain, frequently out of breath. And in phase 3, you might find that your loved one is declining in physical health. They're going to the ER all the time. They're having trouble with daily activities of life. This is a time when you can start considering hospice, also interchangeable with palliative care. Now with hospice, it's not as scary as you think, and it's not the end. But it's something you need to think about. Time becomes more valuable when it's limited. At this point, maybe your loved one's bedbound or in the chair. They can't do what they normally do. They may not be interested in anything, weight loss. And at this point, their goals may change. And if they have a certain kind of disease that they were getting treatment for, it might be a decision to end that and approach comfort measures where you can be at home, you have a team, you're surrounded by your loved ones, and it's not a death sentence. Actually, it's a reprieve, and it is the beginning of your journey. And it's also a good time for you to do all of the things that you want to do. Say goodbye to someone. Go visit the Grand Canyon if you want to. Those things are important. and it is your choice to choose what you would like to do. Now, here's what hospice has to offer. It's comfort, it's not aggressive treatments. You would be at home, wherever you call home. You'll have a team, which I'll explain later. All of your care, medication, supplies, and equipment are provided. Services are on call 24/7, 7 days a week. Hospice doesn't take a break, neither does healthcare and where it goes. You'll have access to trained volunteers and other non-clinical support for the patients and families. What's interesting, while it's not covered under the Medicare benefit, your family will receive the 12 months of bereavement services after the patient dies. So they're actually getting eased in back to their normal life, afterlife with you. Getting hospice services is not hard. People might think it's hard. It might sound hard. It might be intimidating. You might think that your doctor needs to say something first. You don't have to wait for your doctor. You're around your loved one or yourself. You know when you're declining. You might want to look into it yourself. In fact, we have people that call to start asking, I live alone, I don't have anyone, and I know I'm starting to get dementia, and I just want to start getting everything in order. Can we talk about where I can go from here? There's an 800 number. We talk to the person's physician and development of prognosis, and if appropriate, the patient and the family are contacted back, and an admission and consensual visit is being set up.
Hey, Cynthia, if I can pause you for 1 second, there is a question. Is there hospice in the nursing home? And if so, is there any advantage to that?
Yes, we just had a question about the nursing homes. Hospice provides its service wherever a person may live. It could be in their own home. It could be in an assisted living facility. It could be in an apartment. It could be in a nursing home. And in fact, our hospice also takes care of homeless patients. So it's wherever the person lives, and we go wherever they are. So
Excellent. Thank you.
You're welcome. Keep asking the questions. They're important. To be eligible, normally through the conditions of participation for Medicare, you have to have a life-threatening or terminal illness with of 6 months or less. However, if the disease continues in its normal course, it doesn't stop at 6 months. You'll be reevaluated at different times by your physician and the hospice, and you could receive hospice for much longer, much longer. In fact, personally, when my mom was diagnosed, we thought we had 6 months. She wasn't well at all. We ended up with an extra 9 months to have my mother. So we got 15 months. You can't put a price on that at all. You see, I'm with Hospice Care Corporation. We're in 12 counties in north central West Virginia, and we put a lot of time on the road. Let's see. This is an interesting question. How are hospice services paid for? If you've been working, and when you started working, you may not know, but you were paying into Medicare. And in 1982, Medicare offered a hospice benefit with 100% coverage. That is all of your care, your prescriptions, your supplies, the equipment, the staff, everything's covered 100%. Think about it. This is your benefit. You should take advantage what you earned. You deserve it. Our organization takes all kinds of insurance, And also, we also take care of those who have an inability to pay. No one's left out. Here's your team. And we work with your family physician, with your pastor, a whole host of people that we work with and keep them in touch with your progress. Now, who are we? I'm with West Virginia Caring. You may know us as Hospice Care Corporation. We did a rebranding a few years ago. We started as a volunteer organization in 1983 in Preston County and grew to 12 counties over the next several years. We are still a freestanding community-based organization. What does that mean? We're not tied to a big hospital system, healthcare system. We are freestanding. We're locally based in all of our 12 counties. We have 6 offices. We have local people in each of those offices on your care team. In fact, they might be people you know or people you go to church with. Now, what sets us apart? One of the things is it's called open access. But really what that means is we are known for taking the difficult and complex situations. We're called from hospitals outside of the state, very large healthcare systems, and the loved one wants to come back to their county. They might have IVs, they need numerous things, and we take those on while others won't. We have a hospice center that I'm going to talk about in a little bit. We're the only one in North Central West Virginia to have that. And it's for high acuity short-term stays. It's like a hospital for hospice patients. We do oops, sorry y'all. I mentioned the freestanding, the local. We strive for same-day admissions. We work with all of the providers, and we're really known in the community. You'll see us out at a number of things, festivals, fairs. We hold our own health fairs. We do a number of things in the community and partner with other groups. So that sets us apart, as well as Camp Caring. Now here's our hospice center. I mentioned to you that we're the only hospice serving North Central West Virginia that has this beautiful center. It's located in Elkins, and it's, like I said, it's a hospital for hospice patients. We're also the only hospice that carries 4 levels of care. We have the home hospice care benefit, that's wherever you live. We have general inpatient care, is when you would go to the center here if your symptoms are out of control, or let's say you need a medication change and you need to get everything situated. What we try to do there, our goal is to get you back where you need to be, and so you can go home and be with your family, because that's where you want to be. We also have respite care. Now, being the summer right now, this is a great benefit for the family. Sometimes your caregivers get burnout. Being a caregiver is very difficult. Maybe there's a wedding coming up, a reunion, and you wouldn't be able to make it. You could be at the hospice center for up to 5 days in this relaxed, quiet, nice, comfortable environment. And finally, sometimes patients are in their home and they need what's called continuous care or crisis care. And that is 24/7, and it's usually in a very short time because the patient is actively dying. What's the center like? There's a living room, there's a kitchen for families. We allow small pets, well-behaved, open for whenever your loved ones want to visit. And it's a very relaxed, quiet environment. It's not like the hospital where you hear all of the machines bells and whistles and having people come into your room probably every half hour sometimes, or an hour, turning the lights on and doing what is on their schedule. So it's very, very nice. You can also, if you wanted to, you could come and tour it. We'd love to have you just walk around and check it out and see the benefit of it. My stepfather, he passed in our hospice center, the inpatient unit, and so did my brother. So I can attest to the wonderfulness of the hospice center. Being someone that works for West Virginia Caring, I've had the benefit of being on the receiving end. And I can tell you, being on the receiving end, I didn't have to, I was my daughter's, I was the daughter. But at times, I could really be the daughter. I didn't have to worry because we had staff coming in. And here's the bonus, like I mentioned before, which is bereavement care. It is designed for the family and your loved ones. It's 12 months after your loved one dies. We have a number of bereavement volunteers in our department that makes home visits, telephone calls, an annual memorial services. We have lots of them throughout the service area. With those, we honor your loved one in the past year. We've been doing more and more support groups. Last year, because of COVID, not in person, but we developed them on a conference line. And in fact, we're getting better response with those. So we have sudden loss, coping with the loss of your spouse, any number of them, spring, fall, holiday, we have quite a bit. And that's open to the community. Camp Nobby. It's now called Camp Caring. And we've been running this since 1996. And it's for young children who's experienced a loss in the past year. It doesn't have to be someone who was in our hospice program. It's open to any child in West Virginia. And I can tell you, our camp pulls from many places in the state. It's free. It's really good for children because they're attached to a buddy. They develop really important coping skills and things that they can do to work through their grief, their anger, all of those things that could impact them in the future. We want our children to have good behaviors and not develop those that would harm them in any way. That's part of being community centered, and that's who we are. I appreciate allowing me to be here to help you empower the choices you need to make. It's all about you. It's not about the healthcare systems or your physician. I mean, your physician has a part of it, but it's your decision ultimately. Does anyone have any questions?
Yeah, at this time, if anybody has any additional questions, please ask them. Cynthia, you do a great job of taking something that, let's face it, it's an uncomfortable conversation, but it's a conversation that needs to be had, and you do such a great job of bringing it in terms that people are comfortable and understand the choices that they have so that they can make an informed and best decision for themselves. And we just, Doreen and I just really, really appreciate you taking the time to be on Empowering Seniors Now today. And this information is just invaluable. Absolutely invaluable.
Thank you. I really appreciate being here. And there's some of the topics that are on there that you could really go into a deep dive on. Doreen and our organization, we're at a place, like you said, Booker, difficult questions. Sometimes doctors don't want to have those conversations with their patients. They're hardwired to heal. And sometimes the ultimate healing is not curative. Thank you
Absolutely.
very much.
No, we
Yeah.
thank you
Thank you,
very, very
Cindy.
much. Absolutely. Brittany, I'm going to go ahead and turn it over to you.
Thanks, Booker. We'd like to thank everyone for attending. Our next seminar will be on July 21st, and our guest speaker will be announced later on. But before we sign off, we want to talk about our giveaway. Cindy, what do you have to give away today?
I'm excited to have a $50 gift certificate to Mary Kay. There are a lot of women caregivers out there, and you need pampering too.
Hey, before she says that, I am a gentleman who uses Mary Kay on my facial product, so it's more than just women. I just want to point that out. All right, I apologize, Brittany. I just wanted to make sure that men got their proper time in there as well.
Of
And
course.
it's Father's Day, so there you go.
Yes, of course. Well, thank you, Cindy. Our Empowering Seniors webinar today will be shared on Seaman Law Offices and Mountaineer Technology Consultants social media. Please like, share, and comment to be entered in a chance to win the prize for today's show. Thank you so much again for everyone attending our Empowering Seniors Now webinar. We look forward to doing it again, and we hope you can join us next time.